Hi everyone, good afternoon. My name is Sangeeta and I'm the founder and CEO of Helpsy, and we are here for our Helpsy Health series. And today our topic is on health coaching, integrative health coaching. So I have an amazing speaker here with us. She's a good friend of mine, someone who introduced me to holistic nursing and a place where I found my home in combining the Eastern and Western. She comes with many, many years of experience. She's been my mentor and my guide. So I'm really excited to have her here, Priscilla Abercrombie.
Hi,
Priscilla.
everyone. Hi, Sangeeta. It's such a pleasure to be here. Thank you.
Great. We're looking forward to it. So Priscilla has been in women's health nurse practitioner for over 30 years. She completed 2-year fellowship in integrative medicine through the University of Arizona Center for Integrative Medicine, and she's a board certified advanced holistic nurse. She also has certificate in integrative imagery and integrative health coaching. She has practiced at San Francisco General Women's Hospital, as well as Laguna Honda Hospital, UCSF Osher Center, and UCSF Chronic Pelvic Pain Clinic. She was a clinical professor in the UCSF Department of Obstetrics, Gynecology and Reproductive Sciences in the School of Medicine and Community Health Systems. She lectured on nursing and mentored both medical and nursing students and residents. She's on the board of IM for US, which is Integrative Medicine for Underserved. And Dr. Abercrombie currently runs an integrative health coaching practice and offers phone and online consultations. Priscilla, such a pleasure to have you here.
Thank you. Thank you. It's a pleasure to be here.
Well, so let's start from the very beginning. And let's talk about, so our goal today is to talk about health coaching, right? So let's talk about your journey of how you came to this topic of health coaching. It's still something that we're just starting to open up and discuss in our current healthcare system, but I feel like you've been with it for a long time. So
yes, well, you know, it's interesting. I started in nursing very, very young. Started working in hospitals when I was 14 and became a nursing assistant while I was still in high school. So I've been on this nursing track for a long time, and ended up going from an associate degree to a bachelor's degree to a master's degree and finally a PhD in nursing. So I'm a nurse's nurse, and really committed to what nursing is, and that's really looking at the whole person, right? That's what drew me to nursing, because we really believe in that. So I think that's really important to understand about my journey. And also that, you know, when I finished nurse practitioner school, that was in the mid-'80s when HIV was a very big thing for women. Women were just starting to get infected. So I dove into my role as a women's health person, as a women's health nurse practitioner, at a time that was really a crisis time in women's health. Mm-hmm. So, you know, I rode that for a really long time, that wave of women needing care that was specific to them, because the care, of course, the care up until that time was really focused on gay men. So I proceeded through having a clinic for women with HIV for about 15 years. And then, you know, I was really drawn back to my roots. I'd been in conventional medicine. I, you know, knew gynecology really well, but I really missed taking care of the whole person. So that's what drew me back in to do a fellowship in integrative medicine. And for me, in doing a fellowship, unlike my physician colleagues, I was going to home. They were discovering a new part of medicine for them that they had never seen before. So I was, you know, one of the few nurse practitioners in that program at that time. I was in one of the very first classes. So it was really coming home and really resonated with me in my personal as well as professional life, remembering to take care of myself and heal from taking care of people that were quite ill for a long time, taking care of women with HIV who were very complex, with addiction problems and few resources and that kind of thing at San Francisco General. So that was a wonderful way for me to start practicing the reason I came to nursing, that holistic piece. And that is when I ended up at the Osher Center for Integrative Medicine at UCSF. As my journey proceeded, I became interested in women with chronic pelvic pain, which is another very complex condition that really doesn't have any ready answers to it. And integrative medicine was perfect for that. Because again, here are women that are suffering from a complex problem that involves, emotional, sexual, physical, and very complex body systems. So integrative medicine was a great approach to caring for women with chronic pelvic pain. And so I did that for many years as well. And then I really became interested in integrative health coaching because as a provider for, 25 years, I guess I was at that time in my career, I really didn't have the tools to help patients change their behavior. So in many chronic conditions, it's so important for patients to be able to make changes in their lifestyle and in their health behaviors. And as again, as someone who is trained in integrative medicine and conventional medicine, I had never really been trained to coach and to really support people as they make changes in their health behavior. So integrative health coaching has really given me another array of tools to help patients from a provider. So it's been, again, another addition of skills and tools that allow me to take better care of my patients. So that's how I came to here.
Wow, what a beautiful journey. I think every step of the way you've grown as a nurse, as a provider, and brought in more and more value to the world. It's really beautiful, Priscilla.
Thanks. It's been very fulfilling. I mean, I've been fortunate in being able to take that journey and to have the support to do that on many levels.
Yeah, and I'm very lucky that I got to meet you at Osher and when I was starting my nursing career. So I discovered the whole person approach and holistic way of integrating the whole person approach early on in my career when I was just starting out. So I'm really lucky to have started at that note with you.
Yes, me too.
I remember when I first came to the Holistic Nurses Association conference. I was a student in nursing, and I met you, and you talked about how it's possible to integrate both aspects and really look at the whole person. So let's take a step back and define some of the things that you've talked about. I know some of our viewers are already know a lot of these terms, but in case some of them might not. So let's talk about some of the terms that we threw out here. We talked about coaching, then we talked about integrative medicine, and then we talked about integrative health coaching. So do you want to share your definition or how you define these terms?
Yeah. Let me start with what I think is the easy one. The easy one for me is integrative medicine or integrative health. To me, first of all, integrative medicine means someone who is in the medicine field is really taking an approach that is in relationship with patient, I think that's a really important piece of it. Somebody who has studied tools outside of conventional medicine. So hopefully that person has looked at nutrition, physical activity, spirituality, and some of these other aspects, environment, some of these other important aspects of health, and how all of those make for a more holistic approach. And along with that, oftentimes people study things like herbal medicine, Ayurveda, Chinese medicine, traditional Chinese medicine, herbs and acupuncture, know how to work with homeopathy or understand what that is and when it's appropriate to refer. Those kinds of things I think are also a part of integrative medicine. I've come to use the words integrative health more than medicine, because I see that it's broader and it's more inclusive. It really includes all of us that are part of the healthcare team, including the patient, because we're all interested in integrative health. So I just wanted to clarify that. And as far as coaching, wow, that is a can of worms, right? You see all these people who call themselves coaches.
Right.
You know, a coach is not a coach is a coach, right? There's the coach who has been taught to sell a nutritional supplement. There's somebody who's gone to coaching that is really around physical activity and helping people with their physical bodies, exercising appropriately, for instance. So I think that the coaching field is very complex and confusing for patients. Now, integrative health coaching, I think, is pretty specific to those of us that have an integrative background, who have some education in integrative health, and then go on to learn the skills of coaching. I did my education through the University of Arizona Center for Integrative Medicine. So that program has many hours of training, and that training really focuses on getting us up in the skills of motivational interviewing, which is a type of interviewing which again is very patient focused, and getting people to answer more open-ended questions so that they really begin to talk about their lives and think about their health behaviors and what's important to them. So I think, there are many approaches to this coaching, and I've really embraced the more integrative approach and the approach that, again, is a real partnership with patients. Does that help?
Yes, sorry, I tend to mute myself when you're talking, so
Sure.
It doesn't interrupt you. Yeah, this is really beautiful. I think you defined the term so well. I really like the integrative health term so much better than integrative medicine. You're so right. It's about health, and it's about including everybody on the team, because that's when you achieve optimal health, and it takes a village, right?
Yes.
So it is really about including everybody. And I love how you introduced even integrative health coaching, right? That it's about supporting the person with their goals and utilizing motivational interviewing skills to help with understanding what they need and how we help a person to get there, and to getting them to open up about what's important to them, and including them and co-creating the plan with them. So it's still not a very common field or a common skill. Is it something that's expected of us as a healthcare professional, that we should know, we should be able to do it? Why should people care? Like, as a patient or as a client, why should I care about coaching, whether the person I'm seeing, the healthcare professional I'm seeing, is a coach or has studied health coaching or has studied integrative health coaching? Why does it matter to me?
Yeah. Well, when you think about the most of what people are suffering from these days, right? What are the, they're suffering a lot from chronic conditions.
Mm-hmm.
Conventional medicine does not address chronic conditions very well. There is no magic pill, there's no surgery for most chronic conditions. Let me give an example of diabetes. The core things that a patient can do to help their diabetes are to lose weight, to exercise more, to take care of themselves, their stress levels. Those are things that I think most conventional providers do not have time or the skills to address with their patients. So the beauty of having a health coach on the team, on the healthcare team, is that that person is trained to address those issues and really can help patients navigate that journey of caring for themselves and doing a thorough assessment of, we look at the 7 core areas of health for each individual. So we look at their nutrition, their physical activity, their environment, their spirituality, their relationships with others, their resiliency, their sleep, all of those components that are really important to our health. And once we've assessed those and really spent some time exploring with the patient what's important to them, what drives them, why do they want their health? That can really help motivate people and get them on a path to, okay, I want to be here for my grandkids. It's important for me to be active and be able to get on the floor and play with my grandkids. For a lot of people, that's really important. But I'm too overweight to do that. If I got on the floor, I wouldn't be able to get up. So once we understand what motivates and what excites people about their lives, then we can start using that as our goal. It may be that you want to manage your diabetes better, but isn't it more beautiful to be able to be on the floor with your grandkids? Isn't that really what spurs us in our lives, are those personal goals? So being able to look at that and then set up, small doable goals for people around getting there. Getting on the floor. What is it going to take for you to get on the floor with your kids, your grandkids? That makes it more personal, more fun. Yeah.
Yeah, I love it. I love this coaching model, like from the time I learned it. It is. I mean, I think of myself both as a patient and as a healthcare professional. I started this journey as a patient, and think understanding what's important to the person, what's important to me. It wasn't about, for me, it wasn't about the surgery, or it wasn't about weight loss or whatever that end goal was. It was about being able to get up and be able to go work and write code that I like to write. Being able to go out and spend time with friends in the evening and have energy to do that. Right. So yeah, I think I love this idea of being able to understand, looking at that person not as a patient and not as a cancer patient or a diabetes patient, but this is a person and now they have this health condition to deal with that is interfering with their life, and how do we help them to achieve their goal?
Yes.
Yeah, and whenever we've tried that, I find that the success has been much more in terms of making it fulfilling, like you said. The example you gave of the kid on the floor, playing with grandkids. So true, right? That's so much more fulfilling and something to look forward to than, did I take my medications and I'm going to take it every single day. So that's beautiful. You brought that up. You talked about, touched a little bit on making goals, manageable goals. And I think that's where I find that a lot of times we struggle because there is so much information, so much to do. Like you took the example of the diabetes patient, right? So if I'm diagnosed with diabetes, suddenly now I have to learn about new medications. I have to learn about the food, the diabetes counting. Might have to learn about the insulin injections. I might have to learn about measuring my blood glucose. It's just so much, and there is the pressure of, okay, now it's because I need to improve my diet and lifestyle, um, and better handle my life and my stress, when actually more things have been added to my plate of what to do. So
Yes.
so how do you come up with these manageable goals? Because that's where the rub is, right? Like you said, we all want to do it, but there is no magic pill for it. So how do how do we help people create those goals?
So as I alluded to, when we start a relationship with a coaching patient, we really spend or partner, as we oftentimes call people, coaching partners. We really start with doing that assessment around what's important to them in their life, and starting to look at, what kind of changes they want to make in their life. What kind of, where are we going? What would your life look like with change? What would it look like without change? And oftentimes that really, makes a light bulb go off for people around what's important to them, along with really looking at those 7 core areas of health that I talked about. We have people rank those areas of health according to how they've prioritized them. So, for instance, somebody with diabetes may rank their nutrition as a 4 on a scale of 1 to 10. They may also rank their relationships with their family members with a 4 or a 5 and prioritize that area. Whereas they may feel that their environment and their stress level is not as high, for instance. So they start to really kind of work through these 7 areas and identify the areas that they really find important, and areas that they're ready to work on. That can be very different than important to work on, right? Being ready to work on something could be very different. And
Absolutely.
also and how confident they can make a change in that area can be variable too. So we start to kind of parse that out, and then that helps us start to choose an area to work on. So for instance, let's go back to nutrition, and they say, my area of nutrition is a 4. I eat a lot of fast food. It's my problem. I live in a neighborhood, it's a ton of fast food, don't have a lot of money, I don't have a lot of cooking skills. Nobody around here can help me because they don't cook either. So I end up eating a lot of fast food. So that might be an area where we can start to set some goals, and that person may choose to start with a goal, something that looks something like this. I am going to only eat fast food twice a week for the next month. And when I go to eat fast food, I'm going to choose to eat a salad with dressing on the side. And the days of the week that I'm going to do that are, I'm going to choose Monday and Thursday, because those are my days. I'm long at work. I'm not going to have time to prepare anything at home. And I think those are the days that I'm going to target are Monday and Thursday. So I may start working with that person around, so what do you need to do about the other days during the week? How are you going to be prepared to eat at home the rest of those days that week? So you see how the process kind of starts to unfold. We start with the goal of only eating fast food twice a week, but then we really start to look at the rest of the week and how you can support your health and achieving those goals. The ultimate goal of eating better. Does that make sense?
Yeah, it does. It does. Yeah, it does. It makes sense a lot. I can see how, a person can start on this journey, identify what's important to them, and I really like what you said. This is so true, about what they want to work on versus what we think is important to them, because that doesn't really matter. It's, at the end of the day, it's their life, and they're in the driver's seat, right? So if I'm the patient, I'm in the driver's seat.
And they're an expert on their lives, right?
They're yes.
And their bodies.
They are the expert on our lives and our bodies and what we can do. And having this system, like you said, about setting a goal, identifying what's important, and then working on figuring out, having a plan of how to achieve that and why you're achieving it. That's really amazing. So I see that this is kind of like how you start working with somebody when they start working with a health coach, right? You work with assessing and identifying what's important and co-creating their end goal, and then how to get to that end goal by breaking it down into smaller, more achievable goals. And what happens then? So, like you've talked about the beginning of working with an integrative health coach, how does this relationship sustain? How long is it typically when a person starts working with you?
Yeah, so usually the first session is our longest session. It's usually about an hour and a half. And then once we start setting up goals, and I just want to clarify that we use something called SMART goals. So that stands for specific, measurable, action. It's action oriented, right? It's behavior change we want to make. So it's action oriented, and it's realistic for their life, and it's timed. And you probably kind of, when you think back about that goal about eating fast food twice a week and how I was getting really specific about which days of the week, you might even get specific about which meals, it's going to be my dinner. Those kinds of things, making it very specific and measurable helps us when we come back together again and meet. And I can say, did you eat fast? How many times this week did you eat fast food? And it was a very specific goal, so that person can say, I did it or I didn't do it, right?
Mm-hmm.
So we really know whether it was achievable or not. And we may find that it was totally unreasonable to think that that person was only going to eat fast food twice a week. And we really need to change the goal, or they decided that they went crazy and they saw that the goal was really important and they didn't eat any fast food that week because it just really resonated with them, and they just made a big behavior change for themselves and really stayed away from the fast food. Because once we started talking about it, they really realized they were really hurting their bodies, or whatever their realization might be. But that gives you a sense of, we kind of debrief afterward, really look at the goal again. Was it achievable? What would you change about it? Would you keep it? Do you want to keep this goal? Or do you just want to throw it out, and start with something new? And that happens too, where somebody comes back and says, what I really need to work on is getting on my bike. I really love bike riding and I really wish I was on my bike. So then we start to go in that direction and again, come up with a goal that's achievable and realistic and action oriented and measurable. So that's what our work is, that looking back on the journey, how is it, what have you learned from the experience of achieving or not achieving your goal? What does that tell you about yourself and where you want to go next? And then building on that. And the relationship is really, I think, a really beautiful relationship. I love my relationship with my coaching partners because, I'm here to hold the space for them. I'm here to support them. And I'm not thinking about what medication I need to give them or the next patient I need to see in 10 minutes. As a provider, it's a really lovely place, but I think as a patient, it's a really lovely place too. So both of us have a tendency to have a really nice relationship because coaching is so unique. And it's actually very special, I think, that relationship.
Yeah, it is. It really is a very, very special relationship. And I love what you talked about, the SMART goals, that makes it easy, or it makes it possible to figure out how you can be successful, so that it's setting up something that you can try and achieve. It sets you up for success. And I really liked what you talked about in terms of when it was not achievable. That was a learning too. And then it's about figuring out maybe there is another goal that works. Is that evolution. Right, of getting there. I have a health coach that I've been working with for many years. I think before the term became popular. and what you said about this not achieving goal, it really resonated with me, because for example, like I would start out with a goal that I'm going to exercise 5 days a week. But the more I tried to do that, I realized that I was actually had very long hours and I was tired. So if I had to go work out, it was at the cost of my sleep. It was at the cost of me feeling stressed out and rushed and not being able to take my lunch with me, or it just wasn't working for me. So then I realized actually a better goal for me would be to get full sleep. I'll feel happy. I'll wake up fresh to start the day, and that would help me with overall feeling better, because if I'm not sleeping well, I'm cranky and I'm going to eat junk food, which is what I was trying to avoid. So my goal completely changed from exercise to more sleep. But it did help me to get me closer to my goal of feeling better during the day, feeling healthier during the day. So I can see this, how it's an evolution. You might start at one place, but you realize there are so many paths of getting to that end goal, and you can choose your path that works for you.
Yes, you raise a really important point, which is how those areas of health are all interrelated. And you were feeling the tension between needing to exercise and the sleep piece, and started with the exercise piece, but realized that sleep piece was so important for you. And as a result of having better sleep, you were starting to feel better. And I bet you probably had more energy and were more willing to do the exercise that you wanted to start out with because of the sleep. I mean, it's an amazing journey of just navigating this body of ours and this life of ours. And I think that having somebody there to support you and guide you on that journey can be very helpful. And there's a certain amount of accountability as well, with having a coach. When you report back in a couple of weeks, that it's time for you to talk about how it went. And there's a certain amount of accountability that comes with that. And so it helps support you in making things happen.
Absolutely. I think you brought up some key points. It's a beautiful journey because it's about honoring yourself and the path that works for you. that nourishes you. And it's about taking that time for yourself to reflect back and be accountable. And that's really amazing, because I think as much as we say it's my day, but how much time do I really spend thinking about myself and my health? So it is really beautiful to have a coach where you're accountable, and it's a time you're setting aside to think about yourself and your health and your well-being, what's important to you, your goal. So that's amazing. So let's touch on how does this integrative health coaching work within the healthcare system? Is it are you part of the healthcare team? Is it covered by insurance? Can you share a little more about how people go about looking for it?
Yeah. So I really think that you were right at the very beginning when you said that this is really kind of on the cutting edge right now. I think that health coaching is just starting to take off. And what you'll find now, I think, in the healthcare marketplace is really insurance companies have really taken on a lot of health coaching. They are starting to hire a lot of health coaches who are really supporting people, especially around chronic diseases, obesity and diabetes and other chronic conditions, to really heart disease. I'm thinking of high blood pressure, think of all these things that these diseases that really require people to make changes in their behavior and their lifestyle. Those are really conducive to health coaching. So you'll see that. And you'll see a fair number of people that seek coaching on their own. And, I'm in a private practice setting, so I don't work with a health insurance and I don't take insurance here. But I think, health coaches are becoming more and more accessible in the clinic setting as well as through insurance companies. And I think that as we move hopefully our system of healthcare forward, will be having more and more health coaching, because it is helping to change behavior. And patients really usually are quite satisfied with their health as a result of working with a coach.
Oh, absolutely. Absolutely. I'm sure they are. In fact, it helps to achieve the goals that are being set by the medical team. As well, so it furthers that too. You touched on some of the insurance, like you said. It's a new field. People are starting to explore it. Lot of some of the coaches are offering it as a private practice, and then some insurance companies and clinics are starting to offer it because it's really beneficial for chronic conditions and behavior change. Can you touch a little bit more on what kind of insurance companies are offering, or how can a person check out if their insurance company or their employer offers health coaching?
Yeah. And this harkens back to our earlier discussion about what's a coach, right?
Yes.
So you're going to get a lot of variability in what people's educational backgrounds are. Some people won't even have a college degree that are doing coaching. They may have only had a short course. So I think those are questions that as healthcare consumers we need to ask when we're being offered the service of a health coach. The program that I went through was really for health professionals. So everybody is a licensed healthcare provider before they can go through the program. In addition, they've been educated in integrative health. So if that's what you're looking for, make sure you ask the right questions to make sure that the person that you're seeing meets the qualifications that you want. So going back,
talk more about this actually. So because this is an important topic about how does one look for a coach? I mean, not how does one look, but what do you look for in a coach? What's important? Because that's the person who's going to be walking on this journey with you.
Yeah. Yeah, so again, it's really important for patients to think about what is it that they need, what's their level of knowledge, what is it, what are their expectations from the person that they're going to see. So if they want a licensed healthcare provider, they need to ask about that person's training. They need to ask about that person's coaching training. So for instance, the program that I went through had, many hours of, we were observed in a coaching role and graded and tested in an environment where people were listening to us coach and giving us feedback. We also were required to get 100 hours of our own coaching time before we got certification. We had very rigorous training around motivational interviewing, where they recorded conversations to see if we kept to the rules or the guidelines for motivational interviewing, which is very rigorous training, actually. So I think that it depends upon the person, but how much they want to get into the rigors of the coaching programs. But I bring it up so that people can really understand that there is such variability in health coaching and what people's backgrounds are. So you asked about health insurance and what kinds of health insurance companies are actually embracing coaching.
Right.
And I'm a Kaiser member, and Kaiser has health coaching in very different ways. They have a person who's a health coach. So I'm an asthmatic. I have a health coach in the chronic disease program that is an asthma coach. So she really helps me if I ever get sick. I'm with her on the phone getting information, and she's really coaching me on my asthma. And she's a respiratory therapist. So that's an example of a health coach. Through Kaiser, they also have a lot of coaching programs that are really IT programs. So they're very computer-based learning and some interactive computer-based education programs. So in some of the larger insurance plans, like I believe that Blue Cross has a lot of health coaches who help people mostly with chronic disease. And so they're calling people on, in a certain time frame and checking on people and seeing how their blood sugars are doing, or how's their blood pressure, and what kinds of changes are you making in your health. So that's a very different approach than what we talked about, right? So there's a lot of variability in what coaches might be. You hearing me okay?
Yeah, I hear you. I'm getting some background music. Do you hear that?
No.
It's strange. Hold on. I'm just going to close my browser windows just in case.
I don't hear it on your end at all.
Okay. Hello?
Hi.
Okay, can you hear me?
Yeah.
Okay. Sorry. Okay. Yeah, I was just muting myself when you're talking. So yeah, I think that's really interesting that Kaiser has, so people can contact Kaiser, and I think, like you said, some other insurance companies, Blue Shield, a couple others are also starting to have it, and it's more department specific at times. And I think you brought up a really interesting point about what to look for in a coach, because again, it's about figuring out person you're looking for, whether that fits your needs. So let's touch on why would somebody decide to get an integrative health coach, and who influences those decisions. I know one of those factors we talked about is the insurance. We also talked about that a lot of times it's when you have a chronic condition, it's helpful to have a coach, especially for behavior change. Are there any other factors that go into deciding that I should try and find a health coach for myself, or integrative health coach for myself.
Yeah, one of the things to think about is, it's as a provider, I would love to refer most of my patients to a health coach, right? Because I don't have time to address all of the changes that they need to make in their lives to be healthy, right? I don't have the time to coach them. So I would refer them to a coach. But from the patient perspective, what's really important is, are you willing to make some changes in your life? Are you at a time in your life where you are really willing to make those changes? So you've got to be motivated. You've got to have a little bit of introspection about who you are and what's important to you. And you've got to be in a place where you're like willing to make some changes, because this is really about you. Where when you go into the healthcare system and you go in to see your provider, you're expecting them to fix you, right? I want my prescription. I want to be, seen for a pre-op for surgery. There are things that I can get from my provider that are going to make me better. But in the setting of health coaching, that's not usually what it's about. It's really about the patient making some changes in their health. And to do that, they really need the coaching and they need some support, but they need to do the work. They're not going to
Absolutely
make any changes unless they do the work. So
absolutely, I think that's a very, very important point. Is for the success of this, it's about being able to carve out that time for yourself and recognizing that it's important. It's important for you, so it's important for me, and I'm going to make the time and make the effort to do the hard work of this behavior change, to do the hard work of getting to the point that I want, and that helps for this to be successful. So I'm really glad you brought that up. That's really key as well. And are there specific conditions where health coaching is helpful? I know we touched on it a little bit with the chronic conditions, and I remember you mentioned about like asthma, heart disease, diabetes, hypertension. We talked about those. I would add, I think, also stress. High stress jobs. People in those situations could benefit from having a health coach.
Right.
Is there anything else that we might not have touched on?
I think that most people want to make changes in their health. Most people know what their Achilles heel is, right? They know it's their weight, it's their physical activity, it's their stress, it's their relationships with family, or, they know usually what it is. That there are things that we're always working on to better our health. And so I can't say that there's anything that I know of that doesn't, wouldn't apply to coaching. As well as mental health issues, people that are depressed or anxious. There's a lot we can do with coaching to support people.
Absolutely.
I was reflecting while you were speaking about yourself and some of the challenges that you've had and worked with health coaching, and I was thinking about us as women. And how hard it is to focus on ourselves. Everybody else comes first, and we're kind of like, near the bottom of the list, right?
Yeah.
And so for many women, it's hard to come forward and say, I really want to do this for me. And I think that what most women find is that once they do for themselves, everybody else is also benefiting from that. So everyone in their lives usually are affected. When women change, it usually changes the whole family, right?
Absolutely.
Yeah, they have a tendency to make a wave around them. So as a women's health provider, I think that's really important. that women see that their own self-care really should come front and center. Kind of
That's a really important point you brought up, because it's so true. I think for us as women, we tend to care for everybody else. The natural tendency is to care for your family and care for everyone else's needs, and you come last.
Yeah. We need to listen to the flight attendant who says to put the oxygen mask on yourself first, and then, because really that's so true, right? We need to nourish ourselves before we have anything to give anybody else, really. That's
absolutely. And when you're an empty well, like there is the superwoman syndrome many of us have, including me. And the goal is we want to be able to do everything and put ourselves last or ignore our needs. But it affects us, and I think it affects everything we do, because when I'm an empty well, I'm running on low. How can I nourish and support my family or the work or wherever my energy needs to go, because I'm going out of low energy? And like you said, when you focus on yourself, you replenish your energy and you feel good, and you are in a place where you can improve your family, your friends, everyone around you. And it's so true. We see that in almost every client that I've worked with, every patient I've worked with. I've seen that when the woman in the house starts to feed healthy, or when she takes on a goal, it improves the health of the whole family. So I'm really glad you brought that up. And I hope the women who are listening will take that initiative to go and figure out your health first and take time to honor themselves.
Yeah, me too. We're all struggling with balance. In 2016, women, are really struggling with that issue of balance. We're really taking initiative in the workplace. I mean, look at you, CEO of your own company, and trying to manage all of that. And many women are dealing with families and aging parents, and that oftentimes is the role of a woman, to be managing all of that, and again trying to find balance in their lives, and their health oftentimes suffers as a result. So
absolutely, so true. Where do people find health coaches? Let's say I was interested in health coaching. Where can people find it? I know one of the places, what we are trying to do, striving at Helpsy, is to offer access to reliable health coaches and other integrative medicine providers that you can trust, and they're safe and effective. What other places are there, or where else can people look?
Yeah, well, besides Helpsy, I would say, it really depends upon what people are looking for. If they're looking for an integrative health coach, I know one of the resources that we have is the University of Arizona, Tucson. Their Center for Integrative Medicine has a resource list of integratively trained health coaches, people that have gone through their program. So again, they have pretty rigorous certification standards, so that would be a good place. So I would look for the programs, the rigorous programs, and oftentimes those programs will have a list of their graduates and contact information for them. Just as, American Physical Therapy Association, we have a list of people that are, certified physical therapists in various specialties and that kind of thing. I think really going to those organizations can be really helpful.
Absolutely, that's wonderful. We have some audience questions, so let me touch on some of those.
Okay.
So one question is, since you have multiple professional degrees, would you be a practitioner that provides treatment combined with being a coach, or do you see it as separate functions?
Yeah, that's a really good question, and a good thing to ask a coach if you're going to develop a relationship with that person. So usually when I am coaching someone, I have my coaching hat on, and I try to take my nurse practitioner hat off, because the coaching role is so different. I think we talked about that earlier, about that role of a nurse practitioner can be very oriented to giving information, and can be very different than the coach position of really a listener and a guide. So when I'm working with somebody, I'm really specific. I'll say, can I put my nurse practitioner hat on for just a minute? And I really have to be specific about what role I'm in. So that's a really excellent question, because I see those roles as very different, and I try to be very much in the coaching role when I'm working with patients as a coach.
Very interesting and very nice. Yeah. So basically, a coach is a separate person and a separate role than that of your medical provider, who's there to treat the problem and give you the prescription or the treatment plan. A coach's role is different. It's to co-create your goal and to be there for you. So you see it as two separate hats.
Right. It's you've given a really good example, because when I'm in my role as a nurse practitioner, I'm usually telling somebody what I think they should do, right? I'm giving them advice. That's my role as a nurse practitioner, is to assess and give advice. But my role as a coach really is to listen and to reflect and guide somebody to come up with their own solutions, and really see them as an expert, as a full-fledged expert, in co-experts in the room, right? And really honoring them as the guy, as really being in charge of their own health, being the expert on their health and their situation. Yeah.
Absolutely. It's so true. And yeah, very interesting. I see that as, in my coaching role, that I might work on something totally different than what the main problem or the main health issue of the patient might be, right? We might be working on bringing joy to their life, when it could be about managing their A1C number or medication adherence. It could be something completely different. And having that separate position gives that opportunity to do that. And I think it's also interesting from a healthcare team perspective, because when I think of our dynamics as a healthcare professional, it's nice to have that separation. Because then you can fulfill your role as a nurse practitioner, as an MD, as whatever type of provider, and be able to share that information with the patient, and for them to then co-create with the coach in terms of what is most important to them, and work on it. So it helps with load balancing within a healthcare team too. So I really like that. So that was a great question. Let's move on to the next question. So it's about, what is the frequency of appointments that is typical, and how much of the interaction can be on demand versus pre-planned meetings?
Yeah, usually the meetings are pre-planned. But sometimes people have interactions with their coach in between appointments. That may be a quick email, just checking in, may have a quick question. I may send a quick email to somebody and say, hey, I know this week was an important week for you. I hope it's going well. I may just, have a quick check in with somebody that way. But generally speaking, we start out with, I think I started was saying that our first meeting is about an hour and a half. Usually subsequent meetings are anywhere from half an hour to an hour, just depending upon what we're working on and how much time we need to have together. Oftentimes those meetings happen every week or two. And then as that relationship progresses, for instance, maybe after about 10 visits, we may spread them out, because maybe you're on your way and you're really doing well with your goals that you're working on, but you want to check in a monthly and maybe tweak your goals a little bit or add something. But generally you're doing quite well. So it really is personalized according to what people's needs are.
Mm-hmm. Yeah, and last question from the audience is, what is your experience as a coach, from what has been the most surprising or amazing outcome for your client?
Yeah, I think that the most gratifying thing about coaching is seeing people find so much deep work that they do that I could never see in the healthcare setting. And I think they feel the same way, that they had no idea they could make the type of changes that they've made and find so much pleasure in and feel healthful as a result of doing the work that they're doing in a coaching relationship. It's really quite an honor to witness what I've witnessed with my coaching partners. They've done amazingly good work and deep work, and that changed, phenomenal things in their lives. It's quite an honor to witness that.
Absolutely, it is so beautiful to see that. It's very humbling, right?
Yeah, it is. That's a good way to put it.
Yeah,
Yeah.
I remember one story that inspired me was I once worked with a cancer patient, and we worked for a few months together, and over the course of that time, and a little bit after, she completely changed her life. She changed her career. She moved out of her relationship, and she moved to a new location.
Mm.
And she discovered a whole new way of living, or not even discovered, but rediscovered herself.
Mm-hmm.
And it was about the time that she actually got re-diagnosed with cancer. And I remember feeling this pain in me, because I wanted her to feel healthy and better, and to hear that she's been re-diagnosed was sad to hear. But what she said is that in her whole life, she's never felt as healthy as she feels
Mm.
now, even though she's re-diagnosed with cancer.
Yeah.
Um, and that was so powerful. And she felt like she was in the driver's seat in terms of making her decisions and coming from that place of grounding, rather than feeling scared and reacting from that fear.
Lovely
And
example. Lovely. Yeah.
yeah, I could never
It's
have
amazing.
imagined that.
Yeah.
Yeah, so truly it can be such a beautiful relationship and a beautiful journey. I really hope that more people explore their health coach, their health partner,
Mm-hmm.
uh, for themselves, and I hope more and more healthcare centers offer health coaching
Yes.
to the community.
Yeah.
So yeah, thank you so much, Priscilla. It's such an honor
Sure.
to have you, and very excited that you're offering health coaching to the community. How can people find you?
Yeah, so the best way to find me is probably my website, which is womenshealthandhealing.net, and email me through there, and I'd be happy to answer any questions people have and really talk about how we can work together. Because I think, I want to make sure that I meet their needs and that I can meet their expectations, and so it's nice to talk before we set up an appointment and have a chance to get to know each other. So I encourage people to contact me if they're interested.
Wonderful, wonderful. Such a pleasure having you, Priscilla. And
Thank you.
all our audience, I hope this gave you a chance to see what health coaching is, what integrative health coaching is, and how it's about honoring you how it's about honoring us. I consider myself as a patient too, and how it's about honoring us and creating a plan that works for us, for our goal. And I hope that you will take this time to explore health coaching and try to find a coach, try to find that health partner for you. I wish you the best of health and happiness, and we'll see you soon next month with a brand new speaker. Thank you and have a great month.
Thanks, Sankitya. Bye-bye.
Bye.